This video is about case management. First, we will see the meaning of the term case management. It is a strategy employed by purchasers of healthcare services who determine various types of services in order to maintain quality and control cost. It is a care delivery system used by healthcare purchasers. Example, insurance companies. They employ some individuals called case managers, and also they determine the types of services to be provided to the patient to maintain quality of care at the same time controlling the cost. So, insurance companies need not pay extra amount. Hence, this case management is called as managed care. About features of case management, it has four basic features. Number one, it is a method to achieve managed care. In the further slides, we will see how the case management helps to achieve this objective. Second, there is actual coordination of services within the fragmented healthcare system. For example, a patient may receive multiple services from multiple healthcare providers. There is a physician, there may be a surgeon, there may be a dietitian, there may be medical social worker, there may be psychologists or other healthcare providers. So, if there is a case manager, she can actually coordinate all the services of different healthcare providers. The third feature is it helps to strive or it helps to identify at-risk clients. Before the patient actually deteriorate, the risk of deterioration can be identified early if there is a case manager. And lastly, it helps to control the cost both to the consumer and third-party payers like insurance companies. Coming to the components of this system, there are four components, namely case finding, assessment, care planning, and care coordination. First, about case finding. In case finding, identification of individuals who are at risk of hospital admissions. It aims at preventing unplanned admission and try to find patients before their actual deterioration. Thus, it helps to control the cost. Second is assessment. Assessment is the current level of ability of the patient. It also includes assessment of physical and social care needs. Assessment is not only restricted to health needs, it assesses other needs of the patients as well. About care planning, the third component. Care planning addresses individuals' full range of needs including health, personal, social, economic, educational, mental health, ethnic, cultural background and circumstances. Care plan for assess full range of a patient's needs, not only health related needs. This care plan provides structure to individual's care and ensure that goals of different services are aligned with each other. Care plan enables a case manager to make referral to various services as required, to coordinate all the different services the patient may receive, ensure that referrals have been picked up by the concerned person and acted on, and monitor whether the individual has made any progress. The fourth component is very important one, that is the care coordination. This is the main purpose of case management. It helps to reduce duplication of healthcare. It avoids gaps and reduce health and social service cost. It improves disease management and it fosters discharge from the hospital. The common activities in care coordination are: number one, medication management. Here, the case manager confirms that medications are ordered, they are renewed daily, and they are administered to the patients in time. Also, the patient have desired effect and no side effects. Coming to self-care support. That means the case manager will provide the necessary health education both to the family members and to the patient so that the patient can care by himself. It further reduces the cost. Third activity in care coordination is advocacy and negotiation. The word advocacy means acting on behalf of the client and negotiate means bring about something through discussion. By performing this role, a case manager facilitates patient to have access to the services and equipments which are already identified or written in the care plan. The case manager makes sure that the patient gets the services and equipment if it is written in the care plan. Also, the case manager directly negotiates with the service providers for necessary services for the patient. Through this activity, the case manager speeds up the process of obtaining medication, equipment, and other home care services for the patient. The fourth one is offering psychosocial support. And the fifth one, monitoring and review. The monitoring can take place daily, weekly, monthly, or directly in individual's home or also through remote monitoring based on the needs of the patient. Remote monitoring can be done by telephone or telehealth devices. Sixth activity is case closure. Possible methods of case closure or discharge from the case management program include death of the patient gets discharged by himself, or decision by the case manager and multidisciplinary team. About the factors determining effective case management. The key enabling factors are the role and skills of case manager, the case management program design, and factors within the wider system, for example, the organization, mission, vision, philosophy, number of staff, etc. In some hospitals, nurses are employed as case managers by some healthcare purchasers. In that case, their role include advocacy and education. Already we have seen who is an advocate or what is advocacy. It means acting on behalf of the patient so that the patient get all the necessary services and equipments as per the written care plan. As an educator, she will teach the patient in self-care activities to control the cost. Clinical care coordination and facilitation. In the previous slides, we have seen the clinical care activities the case manager has to perform. Thirdly, continuity or transition management. It means the case manager have to make sure that the patient receives continuity of care according to his requirement, or he requires transition management if his condition deteriorate. For example, if a patient condition worsens, he needs to be shifted to ICU for further care or for higher levels of care. That is called as transition management. Fourthly, performance and outcome management. As a case manager, she has to monitor continuously about the outcome that has occurred in the patient. That means whether the patient condition is improving or worsening. And also she has to assess the performance by other healthcare providers. Are they providing quality service as per the needs of the patient? Psychosocial management, it is nothing but establishing or providing psychosocial support to the family as well as his family members, and all other psychosocial needs are met. Coming to research and practice development. The case manager has to conduct research or being part of research and try to improve the practice of case management. Coming to utilization review, it is the critical examination by the case manager of the services received by the patient to make sure that quality care is received or given to the patient at the same time, controlling the cost. Coming to quality management include all the activities that has to be done by a case manager to make sure that the patient receives quality care. It starts from formulation of quality policy or policies related to quality maintenance and quality improvement. And lastly, she has to perform as a discharge planner. That means plan along with the patient so that he or she can maintain long-term health and prevent relapse of his condition, or future admission or emergency admissions can be prevented. So these are the roles of nurse as a case manager. Coming to conclusion, case management is an innovative model of care delivery that can result in improved patient care and shorter hospital stay. Clients are assigned a manager who negotiate with multiple providers so that the patient will obtain diverse services. It decreases fragmentation of care. Here is the end of the session. Thanks for watching.